Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast, where we explore advances in patient care and treatment. Today, we are so pleased to be joined by Dr. Mohammad Adel Shehab, an experienced orthopedic surgeon specializing in the diagnosis and treatment of conditions affecting bones, joints, and muscles, especially in pediatric patients. From managing sport injuries to performing life-changing joint replacements, Dr. Mohammad Adel Shehab will share insights into the latest techniques, recovery strategies, and tips for maintaining optimal musculoskeletal health. Welcome, Dr. Mohammed.
Thank you for having me.
We are so honored and pleased to have you today. And especially we need to discuss more about, in general, the orthopedic field of medicine, where most people think that the orthopedic surgeon only take care about the bones. Is that right or not?
No, not at all, because we also deal with the muscles and tendons and the whole musculoskeletal system, in fact. So the traumas and the conditions that we deal with are not in particular related to the bones itself, but the whole musculoskeletal system, which involves the upper lower limbs, clavicle, the shoulders, and the spine.
Okay. Now, if we want to give pieces of advice for the patients to keep their bone health healthy during their lives, is there any health tips to give it to the patients?
Generally speaking, for any healthy lifestyle, you should have a healthy diet, and I think sports activity also would play a big role in maintaining the healthy musculoskeletal system.
Okay, now most people think that the milk is essential in keeping the bones healthy, and they sometimes tend to consume very large amounts of milk during their day. Is that right or not?
It is healthy, yeah, for sure, but it's not related to the
Not
bone.
that much as they think.
No.
What
not
about
at
the
all.
calcium supplements?
Same thing. Actually, when I was a medical student, I thought the same.
Yeah.
And then when I entered in orthopedics, then I realized that it is not related.
Okay, now if we want to speak about your, let's say, precise major, which is pediatric orthopedic, how is pediatric orthopedics is different than the general orthopedics?
Well, first of all, we are dealing with a skeletal system that is growing. We're talking about the bones, tendons, and muscles, and there are lots of considerations to be taken when dealing with a pediatric patient, especially in regards to the growth, because some of the injuries and conditions might affect the growth of the limbs. So that should be taken in consideration. And the other thing is that any type of intervention that we do, that it will affect the patient's life, because we are starting at the beginning. And the other thing is that each age group, sometimes we deal with them in a different way. But since we are dealing with the kids up to the age of 18, so basically we will be passing the age of maturity. So basically, we deal with them as adults. So that's why the age of the patient is also very important.
Okay, if we speak about orthopedics or pediatric orthopedics, most people might think about only the fractures of the bone, and probably if there's any any problem with the muscles, as you have mentioned before. But can we say that any kind of fractures can happen even for the young kids, like if they are less than 3 years or 2 years?
Oh yeah, definitely. Sometimes we have kids or traumatic incidents which end up in fractures even during delivery. So basically, fractures could happen at any age. And actually, kids are also prone to injuries as the adults, especially those who are doing more of sports activities. But generally speaking, the rehabilitation of kids is much better than adults, especially that we are not talking of, we are not concerned mainly. I'm talking about younger kids with smoking or other conditions such as, for example, diabetes, hypertension, other conditions that might affect the healing process of the patient.
And in addition to the fractures, let's say, what are the common health conditions that may have in relation to orthopedics for the kids?
Well, some of the kids are more prone to have fractures, especially with such conditions as like osteogenesis imperfecta or osteopetrosis. So these patients are born with abnormal formation or abnormal pathology of the bone, which makes them more vulnerable for fractures, easy to get fractured even with a simple fall down, even from a chair. But other than that, if I'm talking about normal kids, the thing is with kids that the tendons are stronger than the bone itself sometimes. So the type of fractures that we deal with is a little bit different than adults. And the other thing is that they have the power of remodeling because they have growth plates, which basically the bone grows from. And this and this gives them the ability to remodel. So for example, if I have an adult patient with a both bone fracture, any sort of angulation in the radius or ulna are not accepted. So that's why you usually treat them surgically with plating and screws and all, with anatomic reduction. But with kids, it's totally different because of the growth plate that they have. Even slight angulation up to, for example, in younger kids, even up to 20 degrees, 15 degrees, it depends on the location, it's accepted. So we can cast the kid, and later on the healing process will take over. But usually we don't want it to be like this, an angulated situation, but in case this happened, still they have this remodeling potential.
So you mean that would deny the myth we have in the society that if the patient or the kid is having a fracture in a young age, that might affect him when he becomes an adult?
Well, it depends. If the fracture crosses, if the fracture line goes all the way to the growth plate, yes, it might affect.
But I think this is, let's say, quite rare.
It depends on the bone. So, for example, if we have a distal femur fracture in a kid, talking around the knee, if the fracture goes all the way and affects the growth plate, unfortunately, the percentage of affecting the growth is around 50%. But usually doesn't stop it from growing. Like it's usually causes some sort of malalignment, angulation, if I can say. But not like usually doesn't stop the whole growth. But I'm taking I gave you an example of extremes, but most of the fractures, no, actually they don't cause much of harm.
Okay, now based on the information you have told us, how could you determine whether the child would require a surgical intervention or just a conservative treatment?
Well, it depends. It depends on the age of the patient. It depends on the bone, which bone broken. And again, it depends on the location, type of the fracture. So lots of things to take in consideration. But the room of treating the kid with non-operative treatment is much, much more than adults. If there is minimal displacement, some sort of angulation could be accepted, which cannot be accepted in adults.
Okay, to what degree that surgical intervention, if you decide to have a surgical intervention, would affect the patient during his growth, and especially if there is any risks in the future?
Well, if the fracture itself went all the way to the growth plate, there will be always a risk of affecting the growth of the bone, whether would end up in a type of deformity or limb length discrepancy. And the other thing is the type of procedure also sometimes affects. So that's why the instruments that we use a little bit different than the adults in order to decrease that sort of a chance of affecting the growth plate. And the other thing is that's why some of the fractures we really need to follow up the patient for even 2 to 3 years, just to make sure that there is no growth effect happened. And the idea is to deal with it at an earlier stage.
Okay, as we have started our segment today with a myth of the milk, if you remember, we need also to end up our segment with another myth. Some people might think that the walker is very useful to be used for the patient or for the kids at the early age, but some health organizations might say we advise always to avoid using them. So as an expert in this field, what do you think about the use of the walker in the early years of the child?
Well, it's debatable, to be honest. But it also, using the walker actually causes more risk of the kids having some sort of injuries, especially if there is stairs in the house or there are harmful objects that the kid can reach. But the debate of how this might affect the hip per se is very much debatable.
Yeah.
But one of the, let's say, adverse effects that could happen from the walker is that, especially if it's very high, the kid tries to, because he's trying to play around, so they would, do a plantar flexion of the foot. So basically they will flex the foot so they can reach the ground.
So they would rely on walking on their fingers rather than their
Exactly.
foot.
So this might end up with tiptoeing.
Okay, that's very great. I think this is the best way to end up our segment today. Hopefully, we can have you again in another segment to discuss more about the pediatric, orthopedics.
Thank you for having me.
Thank you so much.
Thanks.
Our dear viewers, we have reached to the end of our segments with Dr. Mohammad Adel Shehab. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.